Okay, I'd like to call the June meeting of the Albany County Health Committee meeting to order. Rebecca, can we call the roll?
Sure, Mr. Chairman. Ray Joyce,
Present.
McLaughlin, Feston,
Yep.
Peto, Miller, Robinson, Lane,
Present.
Collins,
Here.
and Lockhart.
Here.
You have a quorum.
Thanks. Okay, under previous business, I'd like to get a motion to approve the previous meeting minutes. Motion by Mr. Beston.
Second.
Second by Mr. All in favor?
Aye.
Any opposed? Unanimous. Number 2 and 3, I understand are being tabled at the request of the sponsor. So we'll move right on to number 4. Local law, number B for 2025, a local law of the County of Albany, New York, amending chapter, no chapter number yet, right? Of the Albany County Code, setting forth requirements that the Albany County Department of Health notify local officials regarding elevated containment levels found in drinking water in Albany County. I understand Mr. Miller's carrying this tonight as a co-sponsor?
Yep.
Okay. Any questions from the committee?
Can we request to be added as sponsors at this point?
Yes.
Thank you.
Would you be added, Ms. Lockhart?
No, I'd like to be in
Yeah,
a sponsor.
also.
Okay. Everybody here?
I think I'm already in.
Including-
Okay.
Okay, can we get a motion to move? Motion by Mr. Bestman, second by Mr. Miller, all in favor?
Aye.
Unanimous.
Yeah, you guys are on it already. You're already on it.
Just making sure.
Okay, under current business, number 5, I think we have Department of Mental Health, amending resolution number 286 for 2024 regarding opioid settlement funding. Good evening, Dr. Giordano, how are you tonight?
Hello, everybody. Thank you. You all know Michael Fitzgerald, works as our fiscal director. So the first two are actually similar in the regard that we're asking for contract extensions, no cost, 1-year contract extensions. These are opiate settlement fund awards that we came to you in the past with and were approved. The first one, I believe, is the Catholic Charities Care Coordination Services, is that correct?
Yes.
Yes. So what basically has happened is that the two items that they were awarded money for, they've reached the end of the contract period. They still haven't expended all of it. One was the salary for a SERPA, Certified Recovery Peer Advocate, who's hired and will be paid out shortly after that. And the other part of the contract was for the Trinity Alliance, who is the kind of management organization for the Albany County LEAD program. And this is supporting their administrative directors who are running that program. So we anticipate that the extension we were asking for would be for a year, but they started, their startup time was longer than they expected, so their expenditures will go into the next, if you agree to this, into the next contract period. But they're providing the service that they had initially promised us they would, and that I explained to you in the past. So we're asking for a contract amendment for the 1-year period, no cost extension.
Thank you, Doctor. Do we have any questions from the committee? Okay, hearing none, can we get a motion to move? Motion by Mr. Bestman, second by Mr. Miller, all in favor?
Aye.
Any opposed? Unanimous. Okay, number 6, amending resolution number 281 for 2024 regarding opioid settlement funding.
Thank you. So this is similar theme. This is the Addiction Care Center of Albany. We awarded them last year with your understanding and approval this grant for rental stipends for people who are exiting residential treatment to get them 3-month assistance, getting their life back together. And they've been very successful, but they too took a long time to get their program started. 18 people have gone through the program already, and successfully use those 3 months to either get stable housing or employment. So what we find is that they can expend all the money in the year that the initial contract was stipulating. So we're asking for a contract, a 1-year, no-cost contract extension for this as well. And I should say the goal here is self-sufficiency and long-term recovery amongst the people who have gone through the program, and it's proven to be helpful for the 18 people that have gone through so far.
Thank you, Doctor. Ms. Lockhart?
Question. Doctor, how long do you, once the people successfully complete the program, how long do you follow them for?
Well, so our department doesn't follow the people.
Okay.
They could be in any treatment program in the county.
Mm-hmm.
They're taking advantage of this housing stipend through
Right.
ACCA. We're following ACCA
Okay.
to see if they're, spending the money in the way that they had originally asked for. And it's a 3-month stipend. So the people the 18 that I'm talking about so far have met that and have gone off of the stipend to some semblance of self-sufficient support, but we're not measuring their recovery.
That's what I was referring to, the treatment aspect of the opioid abuse.
Yeah, that is, they graduated from whatever program they might be coming from, and
So we don't know how long
yeah,
they might have stayed and been recovered for.
yeah, this
We
is,
just know that they're 3 months out of the housing project.
that's correct. We've spent many years trying to figure out how to measure, evaluate, and follow folks,
Mhm.
and it's very tricky. Life happens, and someone can come out of a successful treatment program and suffer the death of a family member
Absolutely.
and suddenly relapse, and it had nothing to do with whether treatment was effective or not. And
Absolutely.
a lot of these people are hard to know where they even are. So
Mhm.
our measure is completion of treatment, and in a program like this, stability for the length of the time that we still have contact with them. It's a great question. It's a challenge to the whole field beyond just what we're doing. How do you measure what is success?
I guess I understand what you're saying about relapsing, totally get that. But how many times I might need to come back to help,
Yeah,
for help for
Yes.
housing or
yes.
some of these services.
I don't have the
Yeah,
answer for that.
that's okay.
But
Thank you.
it's the right question.
Okay, thank you.
Ms. Lockhart. Mr. Lane?
Are each of the participants in the program, the 18 that are currently there, are they all originally Albany County residents, or do they come from other areas? around
I
the
can't
county?
speak to that, and we monitor them. They all are Albany County residents.
Should be, at least, that's the expectation.
Yeah, they're coming out of Albany County treatment programs, and as you know, some of the Albany County located treatment programs are regional programs. We have the same question with our mental health programs, like the CDPC, the hospital. Our intent is someone is in one of our programs, but their home county is Greene County. When they're done, we do everything we can to get them back to the county of origin. Those who end up staying in Albany, in this case, we think are
Housing is in Albany.
housing. And the other part of this is that we've struggled also, it's the right question, we've struggled with this for years. It's a free country, people decide to stay in the county that served them.
But, and I understand that part, but at the same time, it seems that certain other counties that are nearby don't, take any
Yeah,
responsibility for the people that they have that
we,
wind up on the taxpayers' cost in
we,
Albany County.
I understand that, and we are sensitive to that and try to mitigate that as best we can. We work with all of the surrounding counties. In some ways, because we have like a state psychiatric center and a lot of drug treatment programs, it's a mecca.
Mhm.
But our system can't treat all those folks once they're done, and we do try to get them back to their counties.
Right, and that's going directly to my point, exactly.
No, I don't
Okay,
take
thank
issue
you.
with that point. Case by case for us, we try to get people back to where they need to
I
be.
appreciate it, thank you.
Sure.
Ms. Lockhart?
One more follow-up to Mr. Lanes. Does this program work with the reentry task force for housing?
The reentry task force on the mental health side, the criminal returning.
For the housing, yeah, for the returning. I mean, I know they're
Yes.
supposed to have,
Yeah.
set when they come out of prison, but it
Yeah.
doesn't always work.
So it's very interesting. I know that we've been
Yeah.
with these issues for so long.
Yeah.
So the reentry task force is not connected on their housing part to
Okay.
this. Those are state parole returnees who have their
Mhm.
own problems. And it's interesting, Mr. Lane, it goes back to this county of origin. Some of the people who come back to Albany County from the prisons, it's where the crime was committed.
Yeah,
And,
that's right.
and now we've got someone who's been in prison for 8 years. They have no county of residence, but they were arrested in Albany County. And so
That's always been,
that's always another problem, but that is not connected to this.
okay,
These
good.
are people who have gone through treatment in Albany County and are coming out. And I will tell you that the statistics that we've seen over the many years that I've been watching this, it roughly breaks down to 80-20. 80% of the Albany County folks in need of treatment are getting it in here,
Mhm.
and 20% of Albany County people are getting treated all over the state, and vice versa. 20% of the people in Albany County getting treatment are from outside. That's a moving target, but that's always been the way it used to break out. I've not seen, the state used to provide us that information. I've not seen that
For
report.
these programs, not so much the reentry.
No, separate
The
from that.
reentry.
I'm talking about the drug treatment programs. It was always like, because a lot of Albany County people are ending up in treatment all over the state,
Yeah.
but it's usually no more than 20%.
Okay, thank you.
Do we have any other questions from the committee? Hearing none, can we get a motion to move?
Motion.
Motion made by Mr. Miller, second by Mr. Peston, all in favor?
Aye.
Any opposed? It's unanimous. Okay, moving on to number 7, amending the 2025 Department of Mental Health budget, inpatient hospitalization costs.
Yes, sir. Well, this is a little bit different, and I understand that there may be a number of questions, and I don't want to give you more information than you need or want. I could talk about this in a lot of different ways, but let me just start by saying this is a request to amend the 2025 budget and to move in from the appropriated fund balance in the county, $6 million to pay for exponentially growing costs. It's an unfunded mandate. It's affecting counties across the state, some worse than us, but some not as bad as us. I could give you whatever background information you'd like about how we got here and why this is happening, but it is a trend that really hit us hard last year, and we're anticipating it again this year.
Ms. Faulkner.
Just, because I'm not totally clear,
Sure.
are these, most of these hospitalizations have to do with people that have been arrested criminally and found not to be able to stand trial,
That's correct.
so they're incompetent, but they're
That's
evaluated that way,
That's
and
correct.
they stay in the hospital until they're either well or whatever.
Well,
So we're paying for.
restored, yeah,
And that has risen by 184%?
yes. Just for, yeah, I have a graph here, just like you, and I can't see the details, but we've been tracking this for a long time, and it started to get in the danger zone a few years ago, and now is at the highest level we've seen across the board. And I will tell you that not everyone who's determined to be incompetent to proceed goes to the hospital. It's only felony charges.
Right.
It's a lot of misdemeanors cases that are found not to be able to proceed because of competency. Charges are dropped. They're sent to the local hospital. It's state covered cost.
Right.
But I think two factors have been in play here. One is in 2021, our previous governor decided to just say that counties which used to be responsible for 50% of this cost were now responsible for 100% statewide. Don't want to make editorial comments on that, but that was kind of like shocking.
I would agree.
And then the increasing kind of demand on our system, more acute people less hospital resources, more people churning through. I've said this here before, that if you don't get the help you need in the hospitals, eventually you're gonna get arrested. And our jail is filled with folks that are treating on our mental health unit. But those who are not able to proceed, the mental hygiene law is very clear. It's the county's responsibility to assign the examiners and then to pay for the hospital costs for their restoration. And some of the restorations are lengthy, and you know, there are daily hospital rates that are very high for forensic hospitals. So,
Just to follow up to that though, so that 184%, is it increase in the number of felons that are now needing hospitalizations because they can't stand trial? Or is it because the state's making us pay 100% of it and not that? Yeah.
well, it's those two plus the fact that the number of requests for these examinations
increasing.
rose from 81 in 2023 to 125 in 2024. That's a function of judicial decisions. And there is a kind of like growing sense that, oh, the mental health system will solve all of the problems. So you got some report, you know, let's get an examination on this person. And for the courts, and the great judges locally, and that many work with us very closely, but if they could get a case diverted and into the mental health system, you know, next, we got plenty coming, so.
But doctor,
Sorry.
to be labeled insufficient to go to trial is a different measure than this person needs help, that, correct?
Well, we almost like prompted you for this. We did not though. Well, here's the issue. The courts think that they're doing a good thing. This person obviously needs some help. Let's get the 7:30 exam, and they'll get help. They get restored. It's not treatment. And restoration can take a long time. And sometimes they come back and they still haven't got the treatment they need. And part of the remedy here, and trying to do it judge by judge, is to explain it's not always the best thing for a person. But I will tell you that the New York State Association of Counties has had this on their priority problem list since 2021, when the governor switched from 50 to 100%. There was legislation in front of the Senate Assembly this year. We've talked to many in support of the bill. It did not get enough traction, but there's legislation afoot. It'll come back next year to lengthen the amount of time that someone could be under the cost of the responsibility of the counties, to allow examiners at the front end to say, this person is not going to be restored. Let's not spend 5 years trying to restore them at extraordinary cost.
Yeah.
And there is movement to get this restoration done on an outpatient basis. But,
There's problems with that then.
well, there's opposition to that, and
Yeah.
it comes from, you know, understandably from the District Attorneys Association. They're not interested because they see this as a public safety issue, which often it is not, but sometimes it is. Any rate, I appreciate the question.
Well, I appreciate you taking the time to talk about some
Well,
of these issues.
listen, I wish I wasn't here with this one tonight, but that is where we're at. And
Well, I think it's important that we understand what's happening.
there are 57 directors of community services in my role around the state. We talk about this a lot
Yeah.
because everyone's getting hit. Again, not in the same way, some more, some less.
And still the people are still ill.
And they still need help.
Yeah, we're not really doing much help. Thank you, doctor, I appreciate your.
Thank you.
Do we have any other questions from Mr. Miller?
Yeah, so my question is a little more on the technical side. It's a
Sure.
big ugly number, obviously, so trying to understand it a little bit more, looking at the backup documents having, maybe it's more from Mr. Fitzgerald, I don't know. On the inpatient hospitalization budget amendment, on that document, it shows a unit cost of, an increase of $6 million for inpatient hospitalization, but then the unit cost is $8 million. Is that just a misprint?
No.
Okay.
No, because the current amount in the line is $2 million, so
Okay.
added with that is
Perfect. So I thought that might be.
We've been trying, you know, to get ahead of this and budget prospectively for it, which we've not been able to.
So that leads right into my next question, which is looking at also in the patient letter one, So we have, it looks like there's a single patient that we owe $2 million on, is that correct?
Yes, that is correct.
And then, so what's the other $4 million is just to try to get ahead of the increases? Is that what you're-
Yeah, because
Is that where
a
that's coming
lot of the
from?
times we've had, and Dr. G has experienced this as well, can range anywhere from month to month, from like 300,000 a month to 500,000 a month. So, yeah, I constantly see those bills. I talk with Steve all the time. I talk to the folks at management and budget, and we all, it's kind of a group effort on that.
Yeah, but just for that basic math part of it for me. So of that 6 million, you're talking 2 million is for this one person, essentially?
Well,
And then the other 400,000 is just for the increases in the cost, is that? I'm just trying to see where the 6 million number comes from.
Well, because the bill was 6 million last year,
Okay,
Yeah.
and so we have a $2 million bill for this one patient.
Yeah.
And we don't see a lot of improvement in the trend from last year.
okay.
So we were adding the 6.
So the budget line says you're going to 12, no, it's 200,000 now, so 8 million rather?
Yeah.
How long was that person for $2 million? How long they've been in the hospital?
That was a couple of years, 4 years?
It says
4 years.
December 2020 through December 2024.
Complicated by the fact that they weren't billing us in a timely way. So we got hit with that all at once.
Mhm.
We have a lot of discussions with the State Office of Mental Health on this, and the Conference of Local Mental Hygiene Directors, and NISAC. There are, got issues with a lot of the players, but we can only kind of deal with it on the ground here. We're trying to educate, we're trying to, minimize the number of these as best we can. Just as an example, we've been tracking this since 2009. Our costs used to be, not that it's insignificant, but $500,000 for many years. The number of requests for examinations were under 50 for many years. 125 the last year, 81 the year before, 75. It just, this is symptomatic of multiple systems problems. And there is some sensitivity at the Senate and the Assembly on this. And there was, as I said, a bill put forth that would try to mitigate some of this. We're hoping next year it'll get more legs, but yeah, I can't, all I can say is I didn't spend $6 million of your money.
Yeah, no. Of taxpayer money.
Of
If I had
taxpayer money.
that money, I would be
And
here.
I feel, but it's my responsibility to ensure that to the degree that we can mitigate this, we do. And, but as you said, there are still 125 people who need help.
Are they mostly at CDPC? Or
No,
are they all
no,
over?
the forensic individual, the cases that are deemed to be incompetent to proceed
Yeah.
at a felony are sent to state hospitals around the state, Mid-Hudson,
Oh, Mid-Hudson, Marcy?
Rochester, and they are, it's a premium rate, premium daily rate.
Can I ask one more question? I don't know if you can answer it or not.
Sure.
I'm sorry. If you could, a magic wand,
Yeah.
what do you think would solve this?
Wow.
To really help these people? I mean, is it institutional, is it
Well, again,
long-term? Is it doing
I-
better evaluations so not everybody's has a 3
There's
to
a lot
5
of
years
pieces
to
that
stay?
all would have to be addressed, and we're trying to, I don't think there's one magic wand thing, but as I said, this is symptomatic of a strained mental health system across the state, inadequate hospital services across the state, emergency rooms that churn people out without addressing their problems sufficiently so they don't come back 5 times a day and they get arrested. Judges who need to understand that this is not getting them treatment, and it's actually hurting the system because this is money that clearly could have, if you all wanted to put into treatment, it would have been better than the hospital costs. All I can say is we know what the key indicators are, and there's efforts across the state to try to address them. I don't see it as a one magic wand issue.
I was gonna say, we could buy you one.
Well, you can still buy me one, but I don't think it'll work.
Thank you.
Thank you.
Thanks, Ms. Lockhart. Do we have any other questions from the committee? Hearing none, can we get a motion to move? Motion by Ms. Lockhart, second by Mr. Lane, all in favor?
Aye.
Any opposed? It's unanimous.
We are
Thank you, Doctor.
grateful for listening to us. Thank you very much to you.
Thanks,
for-
Brad.
Good work. Next up is Department of Health, Mr. Ransom Moore. Last on the agenda is number 8, authorizing an agreement with the New York State Department of Health and Health Research, Inc. regarding the Public Health Emergency Preparedness Program. Good evening, Mr. Moore.
Good evening. So this is a request to enter into a contract with Health Research, Inc. / New York State Department of Health for one of our annual grants. It is the Emergency Preparedness Grant for $341,339. It will run from July 1st of this year until June 30th of next year.
See, it's federally funded. Well, I won't ask tonight, but I know at some point on January 1st, I think we're going to start seeing some cuts to the DOJ and the federal cuts on health and mental health. But do we have any questions from the committee?
Who's being trained under this grant specifically?
Our Medical Reserve Corps, which is basically volunteers, nurses, doctors from the area.
Any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Mr. Collins, second by Mr. Miller, all in favor?
Aye.
Any opposed?
They did a lot during COVID, right?
Yes,
Yeah.
unanimous.
Very
Thank
much
you.
so.
Can we get a motion to adjourn? Mr. Best and Mr. Miller, all in favor?
Aye.
Opposed? Thank you, everybody.
Mr. Chairman, thanks for allowing me to go on a little.
Oh, no, good questions, Heidi. Excellent questions. It's important